Severe strep, that's a new term for me as a mom. I didn't experience that. Is this a new thing?
It's not a new thing, but it's a very, very difficult time to be a parent right now with the rise of infections in our pediatric patients.
How does strep turn deadly?
Yeah. So first of all, we are getting a rise in strep right now because so many children have viruses right now, whether it's RSV or influenza right now. There's a big wave of influenza. And anytime you have a viral infection, you're more susceptible to have a secondary infection. And so we're seeing a rise in strep because of this increase in viruses, and more children are now having a secondary strep infection. And so it's a very, very trying winter right now. And some of these children, especially the children that are younger and more vulnerable, that have pre-existing conditions, or chronic children with medical issues, can't handle that strep as well as healthier children, and it becomes invasive.
What are the symptoms of strep? Because right now we're watching for flu-like symptoms, COVID symptoms, add RSV to the mix. What should people be watching for with strep?
Yeah, if your child is working really hard to breathe, you definitely want them to see a medical professional. If they have a persistent fever, if they have a swelling in their neck area, it'd also be concerning as well. And if they're not able to handle liquids and keep liquids down, I think those are the four main signs that I would seek a healthcare professional's advice.
What's the treatment for strep, Dr. Sood?
Yeah, so with RSV and influenza, those are viruses, but for strep, it's a bacterial infection. And to make things even worse, we're having an antibiotic shortage right now. So you need an antibiotic to treat strep, especially to help prevent it from getting more invasive. So you want to treat it early with an antibiotic. And with the antibiotic shortage right now, we're looking at alternative forms to treat strep. But there are alternatives for these antibiotics that are efficacious. And so if you have a child with a persistent fever, not able to keep liquids or solids down, and is working hard to breathe, definitely go see your physician or pediatrician and get swabbed for strep.
Yeah, because you can check for it and then you can treat it if caught early enough. I was reading this morning, though, we still don't have a strep vaccine, right? We're talking a lot about vaccines for other things. How close are we to getting something like that since it is so prevalent?
Yeah, I haven't read anything, and I've been up to date with the literature. I haven't read anything about any progress on a strep vaccine. We do have a efficacious antibiotic to treat strep. And so right now, to get through this tough time, just work on getting that antibiotic to treat strep and get through this tough time.
The warning is for strep A. Are there other types of strep that are less concerning?
Yeah, so there are different strains of strep, and right now it's to be determined, why are we seeing this rise? But right now, this rise in infection of strep is almost the same level as it was before the pandemic. And so the absolute number of strep cases is actually where we were seeing back in 2018 and 2019. And so there are different strains. It is to be determined if we will exceed those levels from before the pandemic, and it's to be determined if this strain of strep is more virulent and invasive than other strains of strep.
I had always heard, as a kid, if you get strep multiple times, you get your tonsils out and then you don't get it anymore. Is that a myth? Is there truth to that?
And, some people are colonized with some bacteria. And so some children, even adults, can just be colonized with strep or different types of viruses or bacteria, and they can be asymptomatic. But there is truth to the fact that you can get strep multiple times. It just depends on the individual. Some are more susceptible than others.
Adults can get strep as well?
Yeah, this doesn't just pertain to children. The reason why children are being highlighted here is because elderly and children have weaker immune systems, especially the younger children. And right now we're seeing a prevalence in more RSV and influenza, and therefore more secondary infections like strep.
Paint a picture for us, Dr. Sood, of your healthcare system being inundated with all of these different illnesses right now as we go into the holidays and the colder months. What all are you seeing, and how are your staff and teams coping with the influx of patients?
Yeah, I'm really fortunate to be surrounded by colleagues that are just helping us out. And so we, for every ICU bed that becomes available, we're getting calls from outside hospitals to see if we can get one of their patients that bed filled. And so we're getting inundated with RSV, but right now it's flu that's very big. So The respiratory illnesses are peaking right now, and our health system is helping us shuffle beds to make sure we can use the adult ICU beds or the burn ICU beds to get children the care that they need. And the staff has just been doing a tremendous job. The nursing staff, RT staff, the entire pediatric ICU staff, making sure we're taking the best care of children that we know how to.
Yeah. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.